PCOS is a common hormonal disorder that affects approximately 10% of all women between the ages of 12 and 51, called the reproductive age, and it is common across many different populations. Our ovaries have thousands of eggs that are immature. Each immature egg is inside something called a follicle. Every month, a number of mature eggs begin their growth, and they compete with each other. The egg that grows the fastest becomes the mature egg, and that gets released with ovulation. The other immature eggs just go away. What happens in PCOS patients is that all the immature eggs stop developing, and so there is no mature egg to ovulate, and the follicles become a cyst. And that's what we see on ultrasound, that polycystic appearing ovaries. PCOS is diagnosed when at least two of the following symptoms are present: irregular periods because of lack of ovulation, excess male hormones such as testosterone that is seen with blood tests, increased facial hair, severe acne, baldness, and the presence of polycystic looking ovaries on ultrasound, which are the dark circles that you see on the ultrasound. What causes PCOS? Well, there's a combination of both genetic and environmental factors. The genetic factors are those passed down from your parents and grandparents, and the environmental factors are foods that we eat, certain medications, and certain chemical exposures. Let's talk about the genetic factors. Multiple mutations in different areas of the gene are involved. The theory is that there is mutations with common hormones in our body, in particular LH, insulin, and androgens, which are male hormones like testosterone. The high level of testosterone then causes no ovulation, loss of hair from your head, excess pattern hair growth where you don't want it to grow, and acne. Additionally, the lack of ovulation causes irregular period, which can increase the risk of cancer of the uterus, and it also causes infertility. Environmental factors include foods that we eat, particularly those high in carbohydrates, because our body turns those into sugar. These include pasta, potatoes, rice, bread, sweets, sodas, fruits, particularly banana and grapes as an example, and some vegetables like corn. Also, valproate, which is an anti-seizure medication, and some chemical exposures. These may be pesticides, contaminated water, chemicals we consume perhaps in food preservatives, are all potential causative agents. Let's talk about insulin. Insulin is a hormone that gets released every time we eat carbohydrates or sugars. When we eat carbohydrates, our body has to release insulin in order to digest the foods and absorb it to send it to the rest of our organs like the brain, the liver, the muscles, the kidneys, etc. What happens in PCOS patients is that the body releases an enormous amount of insulin in response to the carbohydrate that we eat. This excess in insulin then goes to the ovaries and stops ovulation, increases testosterone even more, goes to the body fat cells and signals them to store fat, makes us hungry, so you eat more and store more fat. If the diet concentration is to increase intake of more vegetables, salads, proteins, and decrease the carbohydrate intake, this will make a big difference since the body won't have to release as much insulin. The complications of PCOS: infertility, miscarriage and premature birth, type 2 diabetes, obesity, cardiovascular disease, mood disorders, and increased risk of endometrial cancer. Treatment of PCOS is concentrated in decreasing insulin resistance, in other words, decreasing the body's excess release of insulin. Mainly this is done via lifestyle changes such as diet and exercise, and also medications such as metformin, which help decrease insulin levels. By decreasing the total amount of insulin, we can reduce the risk of type 2 diabetes, obesity, infertility by improving ovulation, and decrease acne and excess hair. Women who want to get pregnant may be prescribed medications such as Clomid and Letrozole, which increases the chance of ovulation. On the other hand, for women who would like to avoid pregnancy, they can be prescribed birth control containing both estrogen and progesterone. These types of birth control, 1, regulate the menstrual cycle, 2, decreases testosterone level and thus help with acne and excess body hair, and 3, decreases the risk of uterine cancer.